So, good morning, ma'am. I am Etelrica Kabuslay from BSN 2A, and now I will be performing newborn bathing and cord care. So, first, gather all the equipment that are needed. First is the basin with water. Make sure that it is in 38 to 40 degrees Celsius. Cotton balls, our mild soap, the towels, alcohol, yung pagpapalitan ni baby, which is yung cloth, and diaper. And for the procedure, wash your hand thoroughly with soap and water. So, nakapag-wash na po ako ng kamay ko using soap and water. And now, magpe-perform na lang po ako ng hand hygiene using alcohol. So, after that, i-undress na po natin yung baby and i-wrap natin siya in a towel. And then, yung natanggal po nating clothes ni baby is, i-disregard na po muna natin. And then, after po nating marap ng towel si baby, gagamit na po tayo ng cotton ball para po malinisan natin yung eyes ng baby. So, ididip lang po natin siya into water. And then, mag-i-start po tayo sa inner to outer. So, once lang po yung pag-wipe natin, and then dispose. And another cotton ball, ididip po natin siya in water. And then, dito naman po sa kabilang eyes, inner to outer. So, once lang po yung pag-swipe natin, para po hindi ma-irritate yung eyes ni baby. So, after po nating mapunasan yung eyes ni baby, mag-proceed naman na po tayo sa face niya. So, another cotton ball. Aside from cotton ball po, pwede rin po tayong gumamit ng washcloth. Pero mas prefer ko pong gamitin yung cotton ball. So, dito po sa face ni baby, pupunasan lang po natin siya once. And then, dispose. Next is the ears. So, dito po sa ears, make sure that the inside of the ear can be cleaned with roll wisps of damp cotton balls and rotated gently. So, dito po muna sa kabila, rotate gently, and then dispose. Then, another, i-rotate po natin siya gently, and then dispose. So, after po nating ma-wash yung face ni baby, ipapat dry po natin siya using the towel. So, now, pick the baby using a football hold position. So, for football hold, the infant's head is supported with the palm of the hand, while the forearm supports the body and the infant is held against the nurse's side securely. So, cover the ears with middle finger and thumb. So, ito po yung middle finger ko and sa thumb naman po yung sa kabila. And now, position the baby's head over the water basin. So, kapag na-position na po natin siya, babasahin po natin konti yung ulo ni baby. So, after po natin mabasa, is maglalagay na po tayo ng soap sa kamay natin. And then, gently massage the lather scalp using soft bristled brush or baby comb or your fingernails. So, ang gagamitin ko na lang po is fingernails ko. So, imamassage lang po natin siya konti. And then rinse the scalp and then rinse the scalp well and place the baby lying on his back on the side table. So, i-rinse lang po natin siya. And then, after rinsing, ibabalik po natin si baby dito sa table. And then, ipapat dry po natin yung ulo niya. Stop mo pa lang kayo. So now, wash, rinse, and dry the arm and hand of the baby. So, i-hold po natin siya ulit using the football hold. And then, i-expose po natin yung arm ni baby. Make sure na yung arm lamang po niya yung i-expose natin. And then, babasahin po natin siya. And then, maglalagay po ako ng soap sa kamay ko. Then, rinse. So, after po natin mabasa and malagyan ng soap, ipapat dry po natin yung kamay niya. So, after po yung isang kamay, dito naman po tayo sa kabila. And then, football position po, pa rin po. So, expose the other arm. So, after po natin siyang malagyan ng soap and ma-rinse, ipapat dry na po natin siya. And now, wash, rinse, and dry the baby's chest and abdomen. Make sure that you keep the baby covered with blanket in between washing and rinsing. So, i-expose lang po natin yung abdomen and chest ni baby. And then, kukuha po tayo ng washcloth. And then, yun po yung i-dip natin dito sa water. So, pupunasan na lang po natin yung chest ni patient, ni baby. Make sure na hindi po natin masasagi or ma-irritate yung cord, yung umbilical cord ni baby. So, after po nating mapunasan yung chest and abdomen niya, ipapat dry po natin ulit. And now, turn the baby on his back and wash, rinse, and dry the back of the baby. So, isa-side lang po natin si baby. And then, yun lamang po ang i-expose natin. So, using the washcloth again, pupunasan lang po natin yung back niya. And then, after po nating mapunasan, and then, pat dry po natin. So, after po ng abdomen, chest, and yung back ni baby, mag-proceed naman na po tayo dun sa legs niya. So, expose the legs and feet only expose only the feet and leg of the baby. So, one at a time po ito. So, mag-i-start po muna tayo dito sa left na paa niya. Using the washcloth, pupunasan lang po natin yung paa ni baby. And then, after po nating mapunasan ng washcloth with water, ipapat dry lang po natin siya. And then, after po nung isang paa ni baby, doon naman po tayo sa kabila. So, yun lamang pong i-expose natin. And then, using the washcloth with water, so, ipapat dry po natin siya. And then, so now, mag-proceed naman na po tayo sa anterior perineal care ni baby. So, make sure na mag-start po tayo from front to back. So, i-expose lang po natin yung perineal area niya. And then, now, kukuha po tayo ng cotton balls. So, dito po, for females, separate the labia and clean the genita. For females, separate the labia. For females, separate the labia and clean the genital area from front to top and back. So, using moist cotton ball, so, ididip ko po siya into water. And then, isa-separate ko po yung labia ni baby. So, dito po sa kabila, from front to back. Isang stroke lang po or isang swipe lang. And then, ididip po natin ulit yung another cotton ball. Front to back. And then, another one. Front to back po ulit. So, after po natin mapunas yung perineal area niya, pupunasan po natin siya into dry towel. So, after po natin mapunasan, okay na po siya. Pero kapag sa mga uncircumcised male naman, ang gagawin lang po natin is, i-retract lang po natin yung foreskin ng genital area ng patient or yung baby na lalaki and clean the glans penis using moistened cotton ball if it is tight for retraction. Do not exert too much force because sensitive po yung mga baby natin. And then, after swabbing, replace foreskin to prevent edema of the glans penis. And now, clean shaft of the penis and scrotum. So, ganun lamang po ang gagawin natin for sa mga patient na lalaki. Now, after po nating malinisan yung perineal area ng female baby natin, mag-clean naman na po tayo ng posterior perineum and buttocks of the baby. So, ang gagawin lang po natin is i-expose po natin yung below waist or yung part ng perineal area ni patient with the feet exposed. And then, i-grab po natin yung ankles ni baby and then i-raise po natin konti yung paa niya to elevate the buttocks. So, kukuha po tayo ng washcloth and then itataas lang po natin yung paa ni baby and then pupunasan po natin yung perineal area niya or yung buttocks. So, after po nating mapunasan with water, ipapat dry na po natin siya using the towel. So, after po nating mapat dry, ibabalik po natin yung paa ni baby. And then, i-close na po natin yung towel niya. And, that's all for the newborn bathing. So, now, mag-proceed naman na po tayo sa cord care. So, make sure na makakapag-wash po kayo ng hands ninyo before and after po ng procedure natin sa cord care. Using soap and water po dapat. Pero, before that, mag-hand hygiene na lang po muna ako since nakapag-wash na po ako ng kamay ko kanina. And then, now, i-clean na po natin yung cord stump ni baby. So, i-expose lang po natin yung abdomen niya. And then, after exposing, kukuha po tayo ng cotton balls and then lalagyan po natin siya ng alcohol. So, dito po, gently napupunasan lang po natin yung base or yung surroundings ng umbilical area natin. So, after po natin mapunasan, is i-disregard na po natin yung cotton balls and then kukuha po tayo ulit and then lalagyan po natin ng alcohol. So, ngayon naman po is i-gently wipe lang po natin ito from the base to the top of the stump with cotton swab with alcohol. So, dito po yon, pupunasan lang po natin and then itong stump and then dispose. So, kailangan po muna nating hintayin ito na ma-air dry and hindi po dapat natin ito i-pat dry using the towel. So, while waiting, clean urine or bowel movement of the stump. If your baby's stump gets dirty from urine or bowel movement, wash it off right away with water. So, after po nating napa-dry yung umbilical stump or umbilical area ni baby, lalagyan na po natin siya ng diaper. So, i-expose lang po natin yung feet niya. And then, itataas po natin konti. Ito. And then, ilalagay na po natin yung diaper. So, make sure po na sa paglagay po natin ng diaper ay hindi po natin masagi or hindi po natin makover yung umbilical clamp or umbilical area ni baby. So, kapag nailagay na po natin yung diaper, ibabalik po natin sa pwesto yung paa niya. And then, lalagyan na po natin siya ng damit or i-dress na po natin siya. So, itataas lang po natin si baby using the football hold position again. And then, i-dispose na po natin itong towel na nagamit kanina. And then, i-dress na po natin siya. Make sure po na gentle lang po yung pag-dress natin. Take note po pala na in choosing the right clothes for the baby, use loose-fitting clothes will help the stump dry out faster. So, ilalagay lang po natin itong damit niya, one at a time. So, after po nating mailagay yung damit niya, yung sleeves, and dun sa pants, i-close lang po natin ito. So, make sure po ay loose po yung damit ni baby. And then, tapos na po natin siyang ma-dress. So, for additional information lang po, kapag ilalagay na po natin yung baby dun sa crib niya is, kailangan po nating i-change yung linen dun sa crib before po nating i-place si baby. And then, cover the baby with blanket. And then, dispose na po natin yung mga nagamit na materials. So, ilalagay ko na lang po si baby dun sa crib niya, and then ayusin ko na po yung mga nagamit. So, after po nating ma-place si baby dun sa crib niya, and ngayon magwawash na po tayo ng kamay natin to avoid transmitting microorganisms to other people and other patients. So, kailangan po, ang gagawin po natin dito is magwawash po tayo ng kamay natin using soap and water. Pero ngayon po, ang gagawin ko na lang po is mag-alcohol. And then, yun lamang po for the newborn bathing and cord care. Thank you, ma'am.